Treatment of snake bite. Snake bite poisoning is termed epihotoxemia. They are almost exclusively accidental. Of about 21 species of snake found in India, only 5 to 52 are poisonous. However, major cases of poisoning came from 4 major snakes: cobra, common krait, Russell viper, saw-scaled viper, common cobra, naja, class Elapidae. Third labial touches the eye and nasal shield. Neurotoxic or cardiotoxic. Motor nerve cell. Site of action. Fatal dose 50 mg. Yield bite 200 to 350 mg. Fatal period half to 6 hours. Clinical feature: a fear of rapid and unpleasant death. Skin is cold, clammy, pulse is feeble, and rapid breathing is rapid. Psychological shock. Local effect of bite site. Start within 6 to 8 minutes. Bitten area is tender with slight burning pain, minimal local reaction or swelling. 2 fang marks which uses less gradually becomes bluish. Systemic manifestation: malaise, drowsiness, nausea, vomiting, and flushing of faces. So common cobra naja neurotoxic ആണ്. 50 mg 200 to 350 ആണ് yield ചെയ്യുന്നത്. ഹാഫ് ടു 6 hours. Skin is cold, clammy, local effect, bitten area tender and burning pain and other things. Next is a common krait, most common and most poisonous. Bungarus carilus elapidae. Central row of mouth has only 4 infralabial, fourth being the largest. Neurotoxic, motor nerve cell, fatal dose 6 mg, 20 mg is yield bite. Clinical feature: fear and rapid unpleasant death. Skin is cold and clammy, pulse is feeble, rapid breathing is rapid. Psychological shock. Similar to cobra site but less rapid symptoms. No swelling or burning at a site. Milder convulsion, feeling intense of drowsiness and intoxication. That is common krait. Next is saw-scaled viper. Viper is Equus carinatus viperidae. Large triangular head with a small scale. Viper, large triangular head. Vascular dose hematoxic. Endothelial cells and RBC site of action. 8 mg is the fatal dose. 25 mg is the bite. 1 to 2 days is the fatal period. Clinical features: the fear of rapid unpleasant death. Skin is cold and clammy. Pulse is feeble and rapid breathing is rapid. Psychological shock. Local effect on bite site: severe pain, swelling start within 15 minutes. Bite site is red and painful, swelling around and blood stained discharge. Paresthesia around the bite. Extensive local necrosis. Systemic effect: intense pain, vomiting, giddiness, sweating, abdominal pain, dilated pupil, collapse, and finally loss of consciousness. That is saw-scaled viper features. Okay, that is mainly this swelling and blood stain discharge. Okay, next is Russell viper. Dabola russeli viperidae. Large triangular head with a small scale, vascular toxic and hematoxic. Endothelial cells and RBC's action center site. 40 mg the fatal dose. Yield 150 to 200 mg. Fatal period 1 to 2 days. Fear of rapid and unpleasant death. Skin is cold and clammy. Pulse is feeble. Rapid breathing is rapid. Psychological shock. Similar to saw-scaled viper. What they are: severe pains and swelling start within 15 minutes. Bite site is red and painful, swelling around and blood stain discharge. Paresthesia around the bite site. Extensive local necrosis, intense pain, vomiting, giddiness, sweating, abdominal pain, dilated pupil, collapse, and finally loss of consciousness. Okay. Next is common cobra. Another features is pulse regular, depressed, BP normal, feels sleepy, slight intoxicated, weakness of legs and unable to stand and move, frothing from mouth, drooping of lower lip and eyelid, paralysis starting in lower limbs and ascending gradually to affect respiratory muscles including diaphragm and difficulty in respiration, drooping of head due to neck muscle paralysis, difficulty in swallowing and speech, blurring of vision, loss of accommodation, weakness of extraocular muscles, ptosis and strabismus muscle, death from respiratory failure. Saw-scaled viper, pulse weak, irregular BP, significant fall, hemorrhagic syndrome with blood-stained sputum, hemorrhages from gums, rectum site of rectum, there is hemorrhage from the gums and rectum, site of it, etc. due to coagulation time, intravascular hemolysis, hemoglobinuria, renal failure, death due to respiratory failure, circulatory failure, then this respiratory failure, early phase or hemorrhagic and hemolytic complication, later phase. Investigation: 20-minute whole blood clotting test. 20-minute whole blood clotting test. 2 cc of whole blood does not clot if left untouched in a glass tube for 20 minutes in case of viperine snake bite. Also used for monitoring ASP therapy in viperine bite. Snake bite treatment: do it right. Reassure the patient most of snake bite by knowing poisonous snake. Immobilize them same way as fracture limb. Get to hospital immediately. Tell the doctor of any systemic symptoms. Next is treatment: reassure the patient. Immobilize the limb. Application of tourniquet proximal to bite site. Proximal to bite site is not recommended anymore. So application of tourniquet is not recommended anymore. Immobilize the limb like a fracture. Reassure the patient. Wait and watch if patient is brought after 4 to 6 hours with mildly local swelling and no systemic symptoms. Cross-shaped incision at bite site and drain out blood and lymph from cut until antivenom is administered. Clean wound with sterile saline or water saline or water can cover with a sterile dressing. Do not cauterize the wound. Do not cauterize the wound. Infiltrate wound with 2 ml of weak potassium permanganate solution or 2.5% of solution of hypochlorite of lime or 3 ml polyvalent anti-snake venom. Broad spectrum antibiotic in cases of widespread tissues involvement, sedative to relieve pain and anxiety, antihistaminics and cortisone given intravenous to relieve the symptoms, hemodialysis or peritoneal dialysis if renal failure develops. Next is a specific antidote: polyvalent anti-snake venom, common cobra against common cobra, common crater, Russell viper, so skill viper formulation. Freeze-dried lyophilized form dissolved in 100 ml of water, 100 ml root, IV 2 ml per minute, 2 ml per minute, IV 2 ml per minute, IV infusion 5 to 10 ml isotonic fluid per kilogram body weight. Locally around bite mark in case of viper bite to prevent necrosis and gangrene. Dose the same adult dose in children also. Based on a type of snake bite, 1 ml of polyvalent anti-snake venom will neutralize 0.6 milligram cobra and Russell viper and 0.45 milligram of crate and source-killed viper venom. 10 vials for less than 3 hours since bite, 7 vials for more than 3 hours since bite. Repeat after 6 hourly interval till complete recovery or maximum dose of 20 vials reached. Timing: within 6 hours of bite. Within 6 hours of bite. No use if given after that. Within 6 hours of the bite, you should give this antidote. Complication: anaphylactic reaction, serum sickness. Neostigmine 0.5 milligram. 0.5 milligram neostigmine half hourly in cobra bites if neuroparalysis ensures, along with 0.5 milligram atropine blocks the muscarinic side effect of the neostigmine. Heparin 1000 to 5000 international unit in case of viperine bite if coating abnormalities develop. Fresh blood, fresh frozen plasma, cryoprecipitate or platelet concentrate. So treatment is reassure the patient, immobilize the limb, never apply this tourniquet. Wait and watch it about after 4 to 6 hours with a mild local swelling or low systemic inflammation. Cross-shaped incision, clean wound with sterile water, infiltrate wound with a potassium permanganate solution or hypochlorite lime or 3 ml polyvalent anti-snake venom. Broad spectrum antibiotics in case of widespread tissue involvement, sedative, antihistaminics, hemodialysis dialysis. Then common antidote, IV 2 ml per minute, IV infusion 5 to 10 ml isotonic fluid. Based on the type of the snake bite, 1 ml polyvalent anti-snake venom utilize 0.6 milligram. Complication: anaphylactic serum sickness, neostigmine, heparin and atropine. Neostigmine and atropine can be given for a muscarinic side effect. Heparin, abnormal coating, fresh blood plasma, cryoprecipitate plasma concentrate. So Treatment is reassure the patient, immobilize, get to hospital, tell the doctor. Okay, thank you.